Let's turn our attention back once again to the situation in the DRC. Doctors Without Borders has been responding to the deepening humanitarian crisis in Goma, where escalating violence has left thousands of civilians in urgent need of medical care, shelter and basic necessities. With ongoing clashes between armed groups and government forces, access to healthcare remains severely restricted and many people are caught in the crossfire. Claire Waterhouse, is the head of the Operational Support Unit at MSF Southern Africa and joins us now via our video link. Claire, it's lovely to see you. Thank you so much for making time to have this conversation. So much of the focus has been around the spat between the heads of states in some instances and the warring factions, but at the heart of what really should be concerning many people is the impact that this war is having on ordinary people, including women and children. As a start, help us take stock of the context under which people have to live, given just how protracted this conflict has been.
Yeah, thanks so much for having me and for shedding some light on the humanitarian situation in the DRC, in Goma. So this conflict has been going on since 2021, and actually there's even a longer history to it than that. So people are absolutely exhausted. They have been living in terrible conditions for some of them up to 3 years. People are constantly on the move, constantly being displaced as fighting moves around and changes, and it's impacting every facet of their lives. Access to healthcare is extraordinarily difficult for them, but not only that, they don't have shelter, proper food, hygienic conditions in which to live. And of course, all of that just exacerbates the healthcare issues that they're facing. Particularly for women and children, we are seeing these kinds of issues where they are caught in the crossfire, where they are fleeing often and are just completely psychologically, physically, mentally exhausted by this conflict and really struggling.
Yeah, internal displacement has been a big facet of this particular conflict. But not only that, the destruction to infrastructure. I wonder to what extent hospitals are able to operate under these conditions, if at all.
We are really struggling to operate at the moment. So we operate in about 12 areas within that part of the DRC. And we are struggling to access some of our clinics at the moment and hospitals. Well, it's a continual balance. We remain present in all of them, but we have had to reduce our teams because of security issues. We are struggling to get the guarantees that we need in order to ensure our team's safety, which is, of course, of paramount importance to us. Along with that, getting supplies in at the moment and getting supplies to the right places is extremely difficult right now. The roads are often blocked or extremely insecure. The fighting, as we said, moves around a lot. So it's really difficult for us to access some of the places where we need to be. For example, we provide meals to patients within our facilities, and at the moment it's really difficult for us to replenish the food that is needed in those hospitals because we can't access. We're also really struggling to access displacement camps around Goma, and we can only then rely on feedback from our colleagues who are already in place, who are letting us know what has happened. But it is extremely difficult for us to access. Just generally, the infrastructure is weaker than it's ever been, and this is a region that has traditionally had extremely bad infrastructure to begin with.
Yeah, absolutely. It also makes it fertile ground for outbreaks. We've seen in the past infectious diseases like measles, yellow fever, cholera, Ebola. It must be incredibly difficult to keep all of these at bay without the support you need, of course.
Absolutely. So our standard programs include vaccination programs to try to mitigate against these kinds of risks. But of course, with this all happening, normal activities are very difficult to maintain. And as I mentioned before, the water and sanitation situation really makes things even worse. People living in such close proximity without being able to maintain basic standards of hygiene means that there are outbreaks all the time of waterborne diseases. You know, we worry about things like cholera. It is extremely difficult to keep these populations safe and healthy, and that's excluding all of the related injuries we're seeing that are related to the fighting. So we are seeing huge numbers of people coming in with trauma-related wounds, so either directly hit by gunshots, which is sometimes stray bullets, but also sometimes where the warring parties are simply not respecting the basic rules of war
Yeah.
and conflict. And we are also seeing a lot of injuries as a result of shrapnel, which is, of course, extremely concerning to us, as that's completely innocent people just caught in the fighting. It's really awful to witness, and we are seeing people struggling hugely. We are seeing deaths. We are seeing really severe injuries, and we are struggling to keep up with it all.
That was going to be my next question, Claire, the extent to which you reckon lines of demarcation are being respected, especially because accusations have been flying around how, for example, the warring factions aren't necessarily keeping to the rules of war, as it were. To what extent is that hampering your ability to respond to those who need the assistance on time?
Yeah, very much so. So there are basic humanitarian principles that govern the rules of war, and unfortunately, we're not seeing those respected in this conflict. Healthcare facilities should not at any time be a target, and we are seeing either fighting extremely close or within our facilities. Healthcare displacement camps equally should not be a part of the fighting, and yet we are seeing conflict within those camps. Just the other day, we had a bullet pierce the roof of our operating theatre while we were conducting an operation, while we had surgeons in there operating, and that kind of thing is extremely concerning to us, and we really need to adhere to the rules of war so that we can continue to do our job, which is to treat anyone and everyone who needs quality health care.
Untenable at the very least. Claire Waterhouse, thanks very much indeed for speaking to us. Really do appreciate it. Hopefully a solution is forthcoming rather sooner than later. Claire is the head of Operational Support Unit with Doctors Without Borders. They have a presence, of course, in war-torn DRC.